Buluvinaka Dr. Corpus, Really Lovanua, student number 2018-0240, reporting on case number 28. Moving on to the picture attached, it is that of a child between the ages of 1 to 2 years old who is in a supine position and has markings on her neck that is consistent to that of ligature markings. Other things that we can see on her body, on her face, is they are facial venous congestion, petechial hemorrhages, and cyanosis of the lips and ear lobules. All signs, all telltale signs of asphyxiation. Moving on to question number 1. How would I go about the investigation from start to finish? I would first secure the scene and collect witnesses for interrogations. Then I move on to try and identify the victim through both scientific and non-scientific methods before photographing, documenting, and collecting evidences such as one potential weapon, and this could include any cord, any clothing, etc., whose features are consistent to the ligature that is suspected. I'd also collect bloodstain items or any items that may seem out of place, together with tape lifts of the dusted fingerprints, small-scaled evidence, and comb fragments. Then I'd move on to retrieve the personal belongings of the victims and the witnesses for DNA tracing in order to rule out suspects. Moving on, I'd then properly handle and transport the body for autopsy before there is a careful examination of the clothes and the body, both internal and external exams. Now, at autopsy, we try to rule in or rule out causes of the death, and upon external exam, what we found is that there was a ligature mark that is non-continuous and it is almost horizontal, which is almost consistent to that of a ligature strangulation. The only difference between these two is that in our case, the ligature marking actually points up towards the back of the neck, which is more consistent to that of hanging. The marking is also pale and glistening, which is also consistent to that of hanging. We can also find petechial hemorrhages and facial venous congestion, which is due to the compression of the cervical blood vessels. And we also find cyanosis of the lips and ear lobules, which is due to the hypoxia. So moving on to the internal findings, we can find under the skin layers of the neck that there is small hemorrhages, and this is due to the direct trauma of the ligature. We can also find adjacent to that in the muscles ecchymosis, and in terms of the trachea and larynx, we can find that they are congested and have petechial hemorrhaging. When we move on to the lungs, we can find that they are congested, edematous, and emphysematous. The brain and the abdominal organs are also congested. Moving on to question number 2, what is the manner of death? The manner is accidental. Reason being that the ligature marking is consistent with low hanging, a common occurrence in tragedies involving playpens, sleeping cots, window blind cords. The other reason is that the victim's age is within the population that is at most high risk of accidental hanging. Reason being that they are at an age where they are trying to explore their environment. Lastly is the lack of defense marks or drag marks, which would have allowed us to rule in homicide. Moving on to cause of death, the cause is asphyxia and venous congestion combined. In terms of venous congestion, there is obstruction of the cervical blood vessels that can lead to cerebral hypoxia and ischemia. Now, the jugular veins are actually superficial and susceptible to compression via ligature, and its obstruction can lead to venous pooling that can cause hypoxia, which can further cause loss of consciousness. With the loss of consciousness, what happens is that the body loses muscle tone and becomes more flaccid, and this causes the ligature to tighten even more around the neck, which can cause complete carotid artery obstruction. Now, moving on to asphyxia, what happens is that the tongue base is actually being pushed towards the roof of the pharynx. That can also result in the complete blockage of the airway, further in hypoxia. And that is all for case number 28.